ఆధునిక అలవాట్లు స్త్రీలను తల్లులు కాకుండా చేస్తున్నాయి. అందులో పురుషుల లైఫ్ స్టైల్ పెద్ద రోల్ ప్లే చేస్తుందని ఓయాసిస్ సెంటర్ ఫర్ రీప్రొడక్టివ్ మెడిసిన్ మెడికల్ డైరెక్టర్ డాక్టర్ మిస్ దుర్గా ప్రసాద్ చెప్తున్నారు. స్త్రీలకు వచ్చే సమస్యలపై వన్ స్టాప్ సొల్యూషన్ అందిస్తున్నామని దుర్గా అంటున్నారు.
About fertility, the latest trends that the literature and what we see mostly in the magazines and in literature is people who have gone through various treatments, the traditional treatments like IVF or ICSI, and they're still not getting pregnant. We still have to find ways of getting fresher treatments, newer treatments, so that they can get pregnant even after failures of regular treatment. That is one subgroup. The second subgroup is for young women who, having had cancer treatments, fail to achieve pregnancy. So we have to find some kind of treatments for them that we can install, so that even if they have cancer treatments, they can still have the opportunity to get pregnant. So these are the two main groups of people where you have latest trends of fertility treatments. Gents, again, because of the lifestyle that we have, call it pollution, call it adulteration in the foodstuffs that we have, there's a higher increase in fertility problems in men. Nowadays, that is why even the incidence of fertility problems is increasing if you take a couple together. And again, because of all the kind of things that we have spoken about, that is lifestyle as well as pollution, the problems that men seems to have in sperm parameters seems to be rising, again, which causes an increase in the incidence of fertility treatments.
Tell us about Oasis.
Oasis, the center, the main focus of this center are two things. One is specific gynecological procedures. Now, we don't do obstetrics in this center. This is mainly catered for gynecological treatments. So even a young girl from 14 to 16 years old, right up to menopause, we are going to do treatments for them. That is one focus. Now, in these kind of people, there are different specialist clinics that we are organizing, where people who are overweight and have period problems, they will be treated in a specialist clinic with the intervention with a dietitian, with an exercise specialist to help them lose weight, get the right kind of treatment to get their hormonal problems back into order. That's one kind of clinics, but there are different other things as well, which includes clinics for menopause, and clinics for people who have got fibroids, for people who suffer with heavy periods and with painful periods like endometriosis. So we are going to get these specialist clinics also because it helps women to know other women who have the same kind of problems, so that they can share their experiences, talk about different things and form a group. So here we have all the experts that are needed and all the investigations that are needed. Anni ikkade avutai. So they don't have to go to different places and meet different consultants and different specialty people. They'll come here, they'll have all the treatments all under the same roof. That, I think, is our main focus and our main specialty.